Fiscal policy, let's get it right. I've changed it to say fiscal policy, austerity without consolidation. Because I think that's the position we find ourselves in, where for the public sector and for people who rely on the public sector, the current budget conditions feel very much like austerity. An erosion of public sector capabilities, an erosion of the services that are being provided to the poor that people depend on. But on the other hand, not succeeding in stopping the rise in debt. And the main message of today is that this is not a fiscal problem, this is a political problem. And unless the political problem is resolved, we are likely to remain in this condition. So I'm going to start off. Last year I was doing work for the Gauteng Premier, and I want to just show how this austerity feels to the Gauteng Health Department. Then I want to show you and convince you that there is no consolidation and that there's unlikely to be consolidation. And thirdly, look at the policy dilemma that government faces, which I'm calling both directions at once. They're attempting to move in two contradictory directions at the same time. And finally, what is the nature of the real compromises that we require? So first, just a few slides to show you what's been happening in Gauteng Health. And it's really to show, so first of all, this is real per capita spending on healthcare in the Gauteng Health Department. So real per capita spending has increased, is almost doubled over the last decade or so, from about, let's say, 2,000 Rand per person living in Gauteng to now in excess of 3,000 Rand. Per person in Gauteng. So once you take account of the influx of population into the province, once you take account of the, you discount for CPI inflation, consumer inflation, you see expenditure per person has been rising and continues to rise. So from the perspective of Treasury, you look at the situation and you say, well, we've allocated so much additional resources into Gauteng Treasury, into Gauteng Health. Gauteng Health is now the biggest department in Gauteng in budget terms. It's much bigger than, it's overtaken education, right? So there shouldn't be a problem. But you then have to ask, where have these resources gone to? And I'm going to show you 3 slides that show you where the resources have gone to. The first is a rise in the number of employees in Gauteng Health. So this goes back to 1997, and you see during the GIBS period, the total staff establishment fell from about 45,000 down to about 40,000. But since then, there's been a surge in employment over the last decade or so. Or from leading up into the financial crisis, there was a surge of employment. And as fiscal conditions toughened from about 2011, employment levels have stabilized. So that rise in per capita spending was absorbed in the first instance into more staff, more nurses, more doctors, more auxiliary staff in the health system, which is good because that's what delivers healthcare and that's what people rely on. But an even bigger factor has been the surge in wages of those people employed. And this just shows you the nominal change in the average wage in the department. So the average salary in the department, for instance, in 2010, increased by 33% in 1 year. I've compared it here to CPI inflation, and you can see that if you go back further, before the kind of Polokwane moment, you had quite a strong correlation between CPI inflation and wage growth in the public sector. But since the Polokwane moment, in 2007, you've seen a massive rise in salary levels that has far exceeded inflation. So this is the implementation of the occupation-specific dispensation, which I must add was an intervention planned and executed largely under the pre-Zuma administration, under the previous administration, right? Which was a deliberate and conscious improvement in the working conditions of public servants. So that led to a 33% rise in salary in 1 year. Since then, the average salary increase in the Gauteng Health Department has been somewhere in the region of CPI plus 4 every single year. So you've seen a massive gain in the conditions of service of public servants. Thirdly, you have seen a shift in policy from where the resources are allocated within the health department. So hospitals, which used to account for about 70% of the resources in the province, and remember Gauteng has several major national hospitals, Chris Hani Baragwanath, Charlotte Maxeke, Steve Biko in Pretoria. They used to absorb 70% of the resources. But there was a policy choice to shift towards a primary healthcare system. There was a policy choice, not an incorrect one, to massively expand access to antiretroviral therapy, which is administered through the district health services. So as a result of both of those things, you've seen a declining share of the hospitals in the province in the budget, and a rise in districts taking up a share of the budget. Now, what this all means, in kind of conclusion of this section, is that over the last 15 years, you've seen a large increase in the resources available, but this has been absorbed into three factors: a wage shock, a surge in employment, and new allocations for primary healthcare and HIV/AIDS. At the same time, within the resource envelope, there's been these huge shifts away from goods and services towards compensation. And remember, goods and services in healthcare means medicine, medical equipment, gloves, syringes, all of those things that you need to run a hospital. So as wages have expanded, goods and services have been crowded out. There's been a shift away from hospitals towards districts, and there's been a shift away from funding from national through conditional grants towards funding from provincial sources, the provincial equitable share. Also in the last 5 years, you've seen a large increase in payout for medical legal claims, which are not budgeted for, right? And this has all resulted in a financial crisis in the health department, which is manifest in accrued liabilities. So the last time I checked, the department has a budget of about 50 billion. It owes at the end of every year about 6 billion. So it is essentially borrowing an extra 6 billion from its suppliers of all of those goods and services. Effectively, the budget is insufficient to cover the needs of the health department for the whole year. So the budget runs out in October, November, and then they begin saying to GlaxoSmithKline, small businesses that are moving medical waste out of the hospitals, we can't pay you. Wait for next year. You shift the burden onto the next year. April comes, you get a new budget, and immediately you top slice out of that budget all of the money you owe from last year, knowing that by the end of October or November, again, you're going to run out of budget. So while there has been, and by the way, last year, I think 2 years ago, Treasury estimated that the total accrued liabilities in the health system across the country is about 25 billion rand. So this is a hidden deficit, and I'm going to come back to that. So while from Treasury's perspective, you could see, well, we've been giving these people rising resources in real per capita terms. From the perspective of a hospital patient or a person that depends on the public hospital service, you have definitely seen what feels to them like austerity. That results in loss of life. It results in loss of life of children. It results in loss of life of babies on a daily basis in the public hospitals in Gauteng. So it definitely feels like austerity.